Right, so we're going to talk a little bit about Hallux Valgus, and in a moment I'm going to demonstrate what we would look for in the big toe joint with that, and some of the treatment options available with off-the-shelf and casted orthoses. Now, it's a progressive deformity of the first metatarsal phalangeal joint, tends to be a lot more common in women. And we know that it is hereditary, but the exact causes aren't fully understood. Now, what we think is it's the foot type which then predisposes you to getting a bunion, which is hereditary, rather than the actual bunion itself. Now, regarding treatment, there's lots of different things we can try. Splinting is shown to help, manipulation, exercises, lots of things you can do with orthoses. And then at the very end of the line, there are about 130 different types of operation out there available to treat the condition, but that would be the last thing you'd want to try. Okay, so we look at the first MPJ here, and we can classify the grade of this Hallux Valgus using what's called the Manchester foot scale. Now, if we've got a perfect foot with no deformity at all, we'd classify this as a grade 1. A grade 2 means that we'd have a mild deformity, which you can see a little bit of here, and there's a little bit of abduction of that first metatarsal phalangeal joint. A grade 3, you'd see an increased abductus of this joint, and also an increased angle between the first and second metatarsals. And then a grade 4 would be classified as severe, and you'd have quite a protruding joint. And this is obviously a lot harder to manage with orthoses because there's often accompanying osteoarthritis with this. Now, we've got some different treatment options available here with orthoses. The first one is an off-the-shelf BioSkive, which I'm going to use. So the skive area here would help offload the medial column. And then if I remove the first met and the first ray cutout, that allows the first metatarsal to drop into that position, and we could help improve her function with that. Moving on a step further, you can make a custom made. And again, you could go for something a little bit more bespoke depending on your patients or what you found with that patient, and we can do a first met cutout with that as well to help with that first ray function.